He had just made the wing shot, but his body was already sending a warning.
182 over 112? That's never happened before. Why are my legs so swollen? Doctor, my blood pressure is high, my legs keep swelling, and my urine is foamy. What's wrong with me?
Luna, first, urinalysis, kidney function. This sounds like nephrotic syndrome.
Unlike minimal change disease, Marcus already has hypertension and declining kidney function. Based on these clues, which nephrotic syndrome are you thinking of?
Welcome to Marcus's kidney. I'm one of nearly 1 million tiny filters that clean his blood every day. But lately, something has been hurting some of us. Only part of this filter is scarred. That's called segmental. And only some filters are affected. That's called focal. These tiny cells covering every filter are called podocytes. They protect the kidney filter and keep proteins inside your bloodstream. But when podocytes are injured, the filter loses its protection. Without podocytes, proteins escape where they don't belong. Once this area becomes scarred, it can no longer filter blood. When some filters stop working, the healthy ones must work even harder. Over time, that extra stress injures more podocytes and creates even more scars. The good news is, most of us are still healthy. We can slow this disease and preserve kidney function. Let's go back to Dr. Hee Mun and learn how.
We can't reverse scarred glomeruli, but we can protect the healthy filters before they become scarred. What treatments can help slow the progression of FSGS?
Reduce pressure inside the kidney filter, control blood pressure, treat the underlying cause, and for selected patients with primary FSGS, consider immunosuppressive therapy.
Unlike minimal change disease or membranous nephropathy, the hallmark of FSGS is found on light microscopy.
Focal segmental sclerosis. That's exactly what we're seeing.
Because FSGS isn't an immune complex disease, immunofluorescence is usually negative.
Electron microscopy shows diffuse foot process effacement.
In primary FSGS, the podocyte is the primary target. In secondary FSGS, another condition injures the podocyte first. Clinical Pearl. Which gene variant, found mainly in people with recent African ancestry, greatly increases the risk of FSGS?
APOL1!
Think like a nephrologist. Before diagnosing FSGS, what 3 categories should always come to mind?
First, think about genetic causes. Second, HIV, hyperfiltration such as obesity, long-standing hypertension, or reduced kidney mass.
Every cause of FSGS ultimately injures the podocyte. One last challenge. Can you arrange these 4 events in the correct order, starting with the very first step? Excellent! This is the mechanism of FSGS. Understand the sequence, and you'll understand the disease. Treatment begins by asking one question. Is this primary or secondary FSGS? Once you know the cause, you can choose the right treatment. Not every patient with FSGS has the same journey, but by understanding the mechanism, we can give every patient the best chance.
That's strange. Why does this glomerulus look like it's made of sugar?